Sarah Rae. Welcome back to my channel. Happy IBD week. What is IBD, you're probably wondering? Well, that's exactly what this video is all about. But first of all, IBD stands for inflammatory bowel disease. And again, we are going to dive into what IBD is all about. I do have a similar video to this on my channel already, but we are going to talk more in depth and put in a little bit different information in this video than what's in that video. So I will link that video in the description box down below. So it'd be good to watch that video as well as this video. So again, that video will also be in the description box down below. But with that said, let's get talking about IBD. You know the drill. Like, comment, subscribe, hit the bell for notification of when I upload, and let's get the information flowing. So real quick, I just want to apologize if my mom's dogs are playing throughout the video. I'm watching them so they don't wake her up, and so I kind of can't let them go play out there or else they will wake her up. So they're probably going to play throughout the video, so if you hear noises, I apologize. So let's talk about IBD. So first thing to note is IBD is like an umbrella term. Inflammatory bowel disease, it's an umbrella term for multiple different diseases, kind of like COPD is, if you've ever heard that term. That's the same for IBD. And there's a few different diseases under there, but there's a main two that a lot of people talk about, and that is Crohn's disease and ulcerative colitis, and those are the two that we are going to talk about. And one of those is the one you hear me talk about a lot because that's the one I have, and that is Crohn's disease. Fun fact. But so short term for what these diseases are is the inflammation of the digestive tract. Inflammation of the digestive tract. But I want to go in a little deeper for you guys because it is IBD week. These are autoimmune diseases, and what autoimmune diseases are is when the body attacks itself. It's not reading the body as a normal subject. It is viewing it as an invader. And when it comes to IBD, when it comes to these two diseases, it has a normal flora flowing through the digestive tract. And your normal flora is normal bacteria inside the body. So when bad bacteria comes in, it knows the difference between the two. So in a body that has an autoimmune disorder, it views its, again, body as the invader. So it's viewing in a body with IBD, it is viewing the normal flora as invaders, as bad bacteria instead of good. So it sends wherever part of the body it's attacking, and we'll dive into that, but I'm giving you the overview. Whichever part of the body it's attacking, it's going to send down the white blood cells and attack it, turn on the inflammatory markers, which are the white blood cells, and attack. Unfortunately, when it comes to normal flora, it can disintegrate it, but it's just going to grow right back. So these inflammatory markers stay on it, and this cycle just keeps going, right? So what's going to happen? That intestine that it's attacking is going to start getting harmed. So things like cuts, sores, bleeding, all that not good stuff, okay? Now, let's talk about ulcerative colitis. That takes place in the large intestine, your colon. And you see a lot of inflammation and sores when it comes to UC, that's what we call ulcerative colitis. And it takes place in the innermost lining of the intestine. So that's one of the characteristics of UC that we can tell the difference between Crohn's and ulcerative colitis apart, because sometimes it's really hard to tell the difference between the two, and we'll get into the testing stage on how it's hard and why it's hard to really tell the difference between the two. Now, also, when it comes to ulcerative colitis, it is a continuous inflammation in the colon, where Crohn's disease is a mix of healthy intestine and diseased intestine. In Crohn's disease, you can see it in any part of the body, the digestive tract, I should say, really, not any part of the body, the digestive tract specifically. And it will take place in any part of the lining of the digestive tract. Now, it can, when it comes to symptoms, diarrhea, rectal bleeding, abdominal pain, nausea, fatigued, weight loss, loss of appetite, I mean, it sucks. Sores, and it can be very debilitating and even life-threatening, and a lot of people don't get that, and it's really sad. And that's why I try so hard to push education and awareness on these diseases, because people just think they're bathroom diseases, and they are so much more than that. I mean, yeah, kind of are, but. So let's shortly talk about cause. So the cause of IBD is unknown, but they once thought that stress and diet could have played a role in the cause of IBD, but they've since come to realize that it has nothing to do with the cause. It's actually what we call a trigger for the disease, meaning that it aggravates the disease to kind of come on, like in a way. So you already have it. So eating something that doesn't agree with you could aggravate it, or being very stressful. Does that make sense? Can aggravate it. It doesn't cause it to happen. You already have it. So there are some risk factors involved with IBD. So age is one, and it is seen to be that you can get it more before your 30s. So a lot of people are diagnosed before they're 30. And then a lot of people get diagnosed in their 50s and 60s. So they don't see a lot of diagnoses between the ages of 30s and 50s. But, I mean, sometimes it does happen. Also, history, family history. If your family, it runs in your family, you have a higher chance of getting it. Just like, so for example, I've said this before, my mom, she has an autoimmune disease, she has lupus. So that gives me a higher chance of having an autoimmune disease. And if I have a kid, they have a high chance of having an autoimmune disease. What autoimmune disease? We don't know. But they have a high chance of getting IBD. So, that's kind of how it works. Genetics, they actually come to find out that there are 240 gene variants of IBD in the gene pool, which is pretty cool. And environmental factors are playing a role in the cause that they've kind of, or risk factors I should say, in IBD. Let's talk a little bit about complications. So, someone with IBD is more likely to have colon cancer. And this is because inflammation of the colon causes this continuous turnover of the cells in the intestinal lining, which increases the chances of irregularity of the cells that may lead to cancer. So this increases our chances of colon cancer. And another one is skin, eye, and joint inflammation, and we already have a high inflammation marker, so in our body we can, with IBD, it can attack other parts of, it is known, I should say, to attack other parts of our body, especially our eyes, joints, and skin. Medication side effects are another one. So certain medications we take do have side effects of cancer. There is a medication we take called corticosteroids that can have a side effect of osteoporosis, high blood pressure, things of that nature. You can also get blood clots and scarring in your liver as well. Let's dive a little bit deeper into each disease and kind of what can happen having them. So in Crohn's disease, you can get bowel obstructions, and I'm actually making a video on Monday all about bowel obstructions, so I will leave a link in the description box down below when that video happens. Actually, I will make a video link in the description box on all of my videos for IBD week, so make sure you check that out. But as a quick note, bowel obstructions, they are kind of like when the intestinal wall really thickens and nothing can get through, or your intestines twist and it becomes blocked. In some way, shape, or form, the bowel becomes obstructed and nothing can pass through. So some form of procedure has to be done, or surgery has to be done to fix it. And I've had this multiple times. It is that video all about it. Malnutrition is another one. So this is a big one. Also, having Crohn's disease, I'm going to make another dedicated video all about Crohn's disease here in the future, not during IBD week though, but so malnutrition, because your body is on the fritz, it is being, I guess, angry is a good way to put it. I always say it feels like there's piranhas eating inside you. You can't really eat. It's hard to eat when, like, have you ever had a sore and it's red, and you ever tried to touch it with, put peroxide on it and it burns? Yeah, that's like trying to eat something and it just hurts. Okay, but it's kind of 10 times worse than that. So you end up not wanting to eat almost, or you kind of can't eat. You lose your appetite, you become nauseous, you know, it's just becomes really difficult, and in the end you can become malnutrition. You can get malnutrition or become malnutritious. Just try to use my words correctly here. I get so passionate, my words don't come out right, from it, because it becomes hard to eat. Also, when this happens, your nutrition isn't being absorbed correctly through the body because the walls are thickened as well. I forgot to mention that. When your body is being attacked, your intestines are being attacked, that wall starts to thicken as well. So also you can get fissulas, which is kind of an abnormal connection between body parts, and this is kind of like inflammation that's extended through intestinal walls, and anal fissures, which are small tears. So all that can happen with Crohn's disease, and so much more. Those are just like big things. I'm not talking about symptoms, signs or symptoms. I'm talking about like actual big complications. Now, ulcerative colitis. You can get what's called toxic megacolon, which is where your colon rapidly widens and swells, which sounds very unpleasant. You can also get a perforated colon, which is a hole in the colon, and that can also be caused by toxic megacolon. And you can also get very severely dehydrated, which you can also get in certain cases of with Crohn's disease, and I'll talk about that in my next video, which is tomorrow, and that's IBD and ostomies. But I mean, you can get dehydrated. It'll be in that video, and that will be linked in the description box down below once I'm done with it. But and the reason for that is, again, because thickening in the colon and the inflammation, when you're drinking, it all gets absorbed in the colon, okay? That's where the water and the electrolytes and everything gets absorbed. It's in the colon, the large intestine. So when you have all of that going on, when you have a disease like UC attacking the colon, that stuff's not going to absorb correctly when you have things going on like inflammation and sores and all that, because it's going to get missed. A lot of it is going to go by because it can't get absorbed correctly. So you'll get severely dehydrated because that nutrients isn't getting absorbed correctly. And I'm going to talk more about this, but if you don't have a colon, and you have, like in my case, an ostomy, and you have Crohn's disease, you can get severely dehydrated because your body has to find a new way to absorb electrolytes. So, okay, does that make sense? It can get missed, especially with all the inflammation in your body. Of course, it's not a video without Harley. So, tests to tell the difference between ulcerative colitis and Crohn's disease. So, there's a few different blood tests. There's blood tests to tell if there is inflammation, antibodies in your blood. There is blood tests to tell if you have an autoimmune disease. There's a blood test called the Prometheus, and normally tells you, yes, you have chronic inflammation. It can tell you, yes, you have Crohn's disease. Yes, you have ulcerative colitis. It could tell you one of those three things. But normally it's not very reliable. Because mine always came back, yes, you have chronic inflammation. And there's a few others. There's also a few, like a stool test. There's some scope tests that they do. But the main two are endoscopy and colonoscopy. And they do those to check, of course, the patterns for illness. I told you about the patterns for these two diseases. Continuous is ulcerative colitis. Patchy is Crohn's disease mixed in with healthy intestine. So endoscopy is nose and going down and checking the upper intestines. Endoscopy is down and checking the lower intestine and up. So those are those two. And there's a few other scopes that they can do. There's also biopsy. If they see some inflammation or diseased intestine, they can biopsy it and test it and see what it comes back as. That's a really good test. They can also do different x-rays, barium contrast, which is nasty, by the way. There's a small bowel follow through that they can do for Crohn's disease. The other side for ulcerative colitis is the lower GI study, and then there's the CT scans. So those are the multiple different tests that they can do to try to combined say this is what you have, because no one says yes, this is what you have. They have to do combined and say yes, this is what you have. That is what IBD is. So I hope you guys learned a little bit about what IBD is, what Crohn's disease is, what ulcerative colitis is. If there's any other questions you guys have, please leave them in the comment section down below. I will be grateful to answer them to the best of my ability. No, I am not a doctor. I was a CNA, but I am not a professional health worker, like doctor wise, and so I cannot give you any medical advice. I want to make that known. So but I will give you any answer any questions to the best of my ability. But yeah, I hope you guys like the video, and tomorrow we are going to be doing IBD and ostomies as part of our videos for IBD week. And remember to put little purple hearts in the comment section to show support for IBD week. It would be everything for me. And I hope you guys stay safe and well, and thank you for watching. And I will see you guys in the next video. Bye.